Good morning to our partners in the media and to the public. It is time for the COVID briefing for May 13th, 2021. My name is Joe Doherty, and I am 1 week away from being fully vaccinated. Today, our run of show will go as follows. We'll start with, got a little feedback there. Maybe if you guys could put your computers on mute, that'd be awesome. Still there? Okay. All right, thanks. We'll start today with Governor Cox. Governor Cox is going to make an opening statement, and then he'll be available for a few questions before he has to take off. And then once that happens, we'll have questions for a few minutes, and then he'll be followed by Lieutenant Governor Henderson, and then by Dr. Michelle Hofmann, a Deputy Director with the Utah Department of Health, and her last name is spelled Hofmann. So thank you, Governor Cox.
Ladies and gentlemen, it's great to be with you again this week. We were just having a conversation that some of us used to mark time by garbage day, and now many of us mark time by our COVID briefings every week. So we're excited to have you here with us. As was mentioned, I apologize. I do have to leave a little early today, but I want to be able to answer questions that you have. So we are going a little bit out of order. I will go first, then we will have questions, and then we'll turn the floor to Lieutenant Governor Henderson and Dr. Hofmann. So I think probably three things that I want to share today. We are doing very well in the state of Utah. Our vaccine numbers continue to go up. Our economic numbers continue to improve, and that is great news. This is what we were looking for as we get back to normal, as we continue to move out of the pandemic, ending restrictions, and getting things back to normal. Our case counts continue to come down, our hospitalizations and deaths continue to come down, and all of those things are really good news. Which is why, as we announced yesterday, and I know all of you have reported on this, with the state's economic recovery in full swing, there is no shortage of jobs in the state of Utah, and so we announced that we are ending the pandemic extensions. Now, I want to be clear, we are not ending unemployment in the state of Utah. We are just going back to normal unemployment, the way we were before the pandemic hit. The reason for doing that is, of course, that Utah has recovered much faster than the rest of the country, with our unemployment rate now at 2.9%, tied for the lowest in the country. We have, according to jobs.utah.gov, the Department of Workforce's services website, we have 50,000 available job openings, and the job listings aggregator Help Wanted shows 72,000 available jobs in the state of Utah. Now, this change that we have announced will take place. We're giving more than the 30 days that are required. It will be the end of June. And that will impact about 14,000 people who will be losing those extended benefits at the end of June. Now, to be clear, that means there are 3 to 5 jobs available for every one person that would be ending eligibility, those pandemic-related extensions that were granted. So we believe that this is a good sign. It's a good sign that we have jobs available. We're one of only 2 states that have seen job growth over the past year, and that's why we made the decision to end these benefits early. There are lots of jobs available and lots of people who need work, and we have so many services available. Never in the history of our state have we had more services available to help people find work, to help people improve their lot in life, to get additional education, and there are still several other pandemic-related services that are available, helping people, for example, with rental assistance and others. So those will continue, but we need people to get back into the workforce. Now, another thing that I want to talk about, this has been an ongoing conversation, and I've said every week that we would continue to review what is happening around masks in school and make sure that we're making the best decision impacting the most people. Our number one goal all along has been the desire and the need to keep kids in school. We have done that as well, if not better, than any other state. We have been able to keep our kids in school, and I'm grateful again to teachers, parents, especially students who have done everything necessary and everything possible to stay healthy and to stay in school. That in-person learning is so critical, as we have all learned during the pandemic. We have also had cases dropping in many of our school districts. We have many schools where there have been no positive cases now for several weeks. And again, we've been able to vaccinate teachers. We've been able to vaccinate students ages 16 and older. As of yesterday, the announcement was made that we can now open vaccinations to 12 to 15-year-olds to be able to get the Pfizer vaccine. And I know that starting today and tomorrow, many of our 12 to 15-year-olds will be getting those vaccinations, including my own 14-year-old, which we're very excited about. That being said, there has been a request by many superintendents to end the mask mandate at some point. So here's what we're going to do today. I'm excited to announce that because of the low case rates and the way that things are improving here in the state of Utah, school districts will have the option. Let me put it this way. We will be ending the statewide mask mandate for school children for the last week of school. So whatever your last week of school is, starting the Monday of the last week, there will be no statewide requirement for masks in schools that last week. So give kids an opportunity to see their teachers, to see their friends, to spend that last week together without masks if they so choose. Now, school districts will have the option, if they feel like that there is spread happening in their school, they feel like that they do not want to, or that they want to have mask requirements, schools will have that option. Individual school districts will have the option to impose a mask mandate for that last week of school, but that there will be no statewide mask mandate starting that last Monday of the last week of school. We believe that this is the right thing to do. We believe that this is the prudent thing to do. But I will say that masks are still encouraged, and families and children will be able to make those decisions. And I would ask that parents and students and teachers, that everyone be respectful of the choices that are made by those families for that last week. For those that decide that they want to wear masks, please do so, and we encourage you to do so. And those that choose not to, we recognize you as well. We want to make sure that this is a place for everyone where they can feel comfortable and have that opportunity for the last week of school. Now, the last thing I want to address is vaccinations. We've done a great job of getting so many people vaccinated. We talk about it every week, but I can't emphasize this enough. There is nothing more important than getting our vaccine numbers up. This is the miracle that we prayed for. This is what we hoped for. This is the thing. This is it. This is how we get out of this pandemic forever. This is the thing that gets us back to normal. This is the thing that ends and helps us fight off the variants and prevents future variants from happening. This is the thing that helps it from coming back in the fall. This is the answer. This is the only answer. It is vaccinations. And if enough people don't get vaccinated, then we run the risk of having problems and having to deal with these things again in the future. We don't want that to happen. And so I plead with you. We've seen vaccinations slowing down here in the state of Utah. We've seen it across the country. Every governor is dealing with this. We've also seen lots of different attempts to try to encourage and incentivize people to get vaccines. Again, we will never require that. In fact, we were one of the first states in the country to pass a prohibition on government requiring people to get vaccinated. There's nothing that says we can't incentivize people to get vaccinated. And so we've been talking with behavioral scientists. We've been talking with residents. We've been talking with other governors. We've been talking with health officials. What can we do? What things will work to help incentivize people who are on the fence, who are maybe right there, not sure what to do? You've seen across the country that there have been lots of different incentives to try to get people vaccinated. In some places, they're giving away fishing licenses. Other places, they're giving away alcohol, beer, and shots, anything to try to get people to do that. We appreciate the private sector who are doing things to encourage people, whether it's free donuts or other things. But there was a very interesting announcement yesterday that came out of Ohio, where they announced a drawing for $1 million, 5 drawings actually, for people who have been vaccinated as a way to encourage people to get the vaccines. This is something I'm very interested in. We had actually had several conversations prior to Ohio's announcement yesterday about ways that we could incentivize people to do that. This is one of the ideas that was floated out there. Now, I recognize that we don't have raffles or gambling in the state of Utah, and I want to be very clear that this is not that. This is not that type of thing. People aren't paying in to it. It's not a lottery, as I've often said. Lotteries are taxes on people that are bad at math. That is not this, and so we are working with the legislature to come up with new and innovative ideas. I believe that this is one of those ideas. It's something that I support. We're having our legal teams look at it, and we will be meeting with the legislature to get their buy-in. Obviously, they would have to appropriate the funds for this, but there is no amount of money that is too much to help us get an extra 5 or 10% of people vaccinated. When you look at the damage that has happened to our economy, to our nation, because of this pandemic, anything we can do to encourage more people to get vaccinated. And if this is one of those things, then we will take it. If you have other ideas, please send them our way. We really have to think outside the box. We have to think, again, this is something that happens once every 100 years. We shouldn't treat it like just another thing. This is not like encouraging people to get the flu vaccine every year. This is something very different. This is something very specific. And this is something that can certainly help us over time. So I look forward to working with the legislature on this idea and others to do everything we can. But I hope that people won't need some sort of outside motivation, that they'll do it because it protects them, it protects their families, it protects their neighbors, protects our economy. It's safe, and it's the thing that we've been waiting for. So please don't wait. I will say, if we do something like this, it would apply to everyone that has gotten the vaccine, not just people that are getting it going forward. And so I'm very excited to hear what ideas come forward and see if we can't do more to push us up towards 70 and 80%, 90% vaccinations. So with that, I have some time to answer a few questions, and I'm sure you might have one or two.
Hi, Governor Cox. I'm wondering if you can talk about why you made the decision to lift the mask mandate just for the last week of school rather than just doing it across the board.
Yeah, so there's a couple reasons for that. One, this is something that I actually talked to our team about maybe a month and a half ago, something that I had been thinking about and working on. So look, there's the reasons for this. Again, there are a lot of people, and rightly so, that would really want their kids to be able to have some time with their teachers. I think about kids in elementary school that haven't been able to see their teacher's face and their friends' faces. That stuff matters. It's really important. We also have seen cases coming down, right? So that was important as well. That we're not seeing the type of community spread that we had in the past. But we also know that there are some families and some kids who may be at higher risk, where this will be an unpopular decision with them and their families. Again, we have better masks, and we still encourage kids to wear masks. But if there are families who feel like that is a situation where they don't want their kids to be, the last week of school is an opportunity for there's less going on. Most of the testing is done. Most of the rigorous academics is done that last week. And so we felt like this was a really solid compromise opportunity for kids to have that ability to go to school without masks. But again, leaving it up to the local school districts to make that ultimate decision. If the schools do nothing, then the mask mandate will go away. But if the schools take a proactive step and decide that they want to keep masks that last week, they're certainly entitled to do that.
Hi, Governor Cox. This is Spencer from Fox 13. I just want to ask about you touched on it, that there are definitely going to be critics on both sides of this. We've seen in recent weeks those individuals in these school board meetings that are virulently advocating for no masks in schools. On the other side of that, there are going to be parents that are upset with the decision to take away, even for that last week, these the K through 12 mask mandate. And so what's your response to those that would criticize this decision on both sides of the argument?
Sure. Well, we've certainly taken a lot of criticism, and that's normal. That's part of the job, and it's been this pandemic. What I would say is that getting into a getting out of a pandemic is almost as messy as getting into a pandemic, right? There's no exact timing. No one knows when the right time is to do these things. What we've tried to do is try to be very balanced in our approach. We've tried to avoid extremes throughout this, and this goes back to Governor Herbert, who I commend for his leadership in the early days of the pandemic. We are thoughtful about what we do. We take input from all sides, but especially from the experts. We've been working very closely with Superintendent Dixon on this, working with superintendents across the state, getting feedback from them about what's happening on the ground. We've looked at the numbers. We have some rural school districts where they have had 0 cases over the past month, right? And so understanding the health side of this and the impact on kids. We also have vaccinations again now happening for older kids, which is where we saw the biggest spread, and where we saw where there were some health problems and hospitalizations. That tends towards the older group who have now had an opportunity to get vaccinated. And so that's what I would say. Look, I understand that every one of these decisions is unpopular, but at some point we have to move out of this, and we've done that. And we got rid of the broader mask mandate on April 10th. We had other restrictions go away in May, the first or second weekend, or excuse me, the first week in May. And now we're seeing it's just the natural next step with all of this as we move our way out of this. Again, trying to do it in the right way, not too fast, but not too slow. And some will disagree, but I think the majority would agree that we're hitting that at about the right spot.
Hey, Governor, it's Michael Locklear with 2 News. I was in the Morgan County School District yesterday, and their board decided to go ahead and get rid of the mask mandate. So as of yesterday, most students were not wearing masks. Do you have any reaction to them making that move, jumping the gun a little bit on your announcement here, accelerating the timeline?
No, I don't. Look, we're so close, right, to the end of the year. I appreciate those school districts that have done their very best to manage these expectations and to move forward. Look, again, it's been difficult for everyone in a leadership position who has to make these important decisions. What I will say is I'm grateful for everybody who has hung with us as we've been able to make it this far and keep kids in school. That has always been our goal. I'm very proud of everyone who has done that. But most importantly, I just want to thank the students, right? They've been incredible throughout this. We're grateful for the sacrifices that they've made, the way they've been able to work together. We've had so many states that have come to us. In fact, the national government came to us, the federal government. They were rolling back some of the restrictions in schools because of the research that we did here and the way that we did what we did. So again, we want to empower people to make these decisions, to keep themselves and their families safe. And with case counts so low, we're less worried now than we would have been 3 or 4 months ago.
Good morning, Governor. This is Jacob Klopfenstein with KSL.com. I wanted to ask about the decision yesterday about ending the pandemic unemployment assistance. One reason I've heard kicked around for a reason for ending that is that it disincentivizes people to want to go back to work, kind of varying degrees of credibility on whether that's actually true or not. I guess another reason, I've heard is that people are, a bit frustrated with, I guess, the current state of the labor market, frustrated with low wages and things like that. Utah's minimum wage is still $7.25 an hour. I guess what if anything is being done in the state right now to improve the labor market, improve conditions for workers and things like that?
Sure. Yeah. Thank you. So look, I think it's important to focus on the purpose of these extensions. Again, we're not getting rid of unemployment. What we're getting rid of are the extensions that were specifically put in place because of the pandemic, and rightfully so and thankfully so. These extensions have helped families, they've helped our economy, they've helped us to weather the storm. Now, we are at 2.9% unemployment in the state of Utah. And when I say we have 50 to 70,000 jobs, yes, some of those are minimum wage jobs, but most of them are not. And a significant number of them are really, really great jobs. And this idea that, I mean, that economists are telling us that it has no impact is, I mean, these are the same economists that told us that we were going to have a record job growth last month, and they were completely wrong. It doesn't take an economist or a rocket scientist to understand that if you pay people to not do something, they're going to do that. I mean, this isn't a condemnation of them. At all. It's a very rational choice and a choice that most people would make. And so what we have to do now is, again, incentivize people to get back to work, and the labor market will have to take care of some of those things. But here's what's important. What's important is that for those jobs that do pay a high wage, that we have opportunities for people to improve their lot in life if they need to improve their training or their education. Again, we've never had more available to help people improve their lot in life than we have right now. Wages will go up. There is no question. We're already starting to see that. I've talked to many employers across the state that are increasing wages, and so we want that to happen, and it will happen, and we encourage employers out there to increase wages. We're also unfortunately seeing an increase in inflation, and again, bad monetary policy leads to these outcomes. Now, these extensions are set to go away in September, and we've already heard from Congress that there will not be an extension. Democratic senators, I think Joe Manchin yesterday mentioned that he would not vote to extend those in September. I promise you that Utah's economy right now will be better than the nation's economy in September when you look at unemployment rates and job availability and all of those things. And so I feel like this is the right decision for Utah right now. And again, there are 3 to 5 jobs available for every one person whose benefits will be ending in the 1st of July. Again, we're not taking them away sooner. We've given a long runway for people to start to prepare and to start to apply and to find those jobs so that they can get back into the workforce. And we feel like this is the right thing to do for everyone in the state. Okay, we got time for one more question.
Governor, hello. It's Sean Means from the Salt Lake Tribune.
Hey, Sean.
This question for you, or perhaps for Dr. Hofmann. As the state moves away from mass vaccination clinics to smaller venues, can you talk about the effort to bring the vaccines into doctors' offices?
Sure.
How much of the vaccine supply is going to go to doctors' offices? How will the state determine which doctors get more or fewer doses? And is there any early data about how successful shifting vaccines to doctors' offices have been so far in increasing the uptake of the vaccine?
Thanks, Sean. So what I'll do is I'll answer your question the best that I can, and then we'll have Lieutenant Governor Henderson come and talk, and then Dr. Hofmann will talk, and then she can answer the rest of the question better than I can be. So we had this high throughput coalition that was meeting regularly, and these are the mass vaccination sites. And what was great about that is we were able to be incredibly nimble. They worked together. They met every week, and as one part of the state needed more vaccines than another, we were able to shift things around. We're doing the same thing with our low throughput coalition, and now they're all meeting together to have these conversations. So we're pushing these out to doctors and again to our mobile clinics. It will really be driven by supply and demand, and we can make those. We can audible every week and shuffle those resources around. So as doctors need more and are doing better, we'll get it to them. We'll get them as much as they need anywhere it needs to go. We have ample supply right now, and we're excited. I don't know that we have any real data yet on how successful that has been, but what I can tell you is that from polling data and survey data that we've seen, not just in our state, but in other states, when we ask, to the vaccine hesitant crowd, who are you most likely to trust and where would you most be willing to get the vaccine. So we're talking about a smaller percentage of the population, but they're the population that's hesitant. And overwhelmingly, in some studies I saw, it was 60 to 70% of them said that it was their family practice doctor that they would most listen to and most be willing to get the shot from. So we think that that will have a huge impact, but you won't see those numbers overnight. You know, it's not like we're going to vaccinate 100,000 people at family doctors. This is kind of hand to hand, right? One person at a time. So it's going to be much slower, but we think that over time it will significantly increase and it will get us that last 5 to 10% that we really need. So with that, again, thank you for all your questions. Thanks for covering this. I'll turn the time over to Lieutenant Governor Henderson, and we'll go from there. Thank you.
Good morning. I've just got a quick update on vaccines and a couple other things, and then we'll let Dr. Hofmann come and talk. Vaccine numbers as of yesterday, 2,355,333 doses of vaccine have been administered, a daily increase of 14,578 doses since yesterday. So we've got almost 58% of eligible people in Utah that have received at least one dose of vaccine, which is really encouraging. 46% of eligible Utahns. Now, this is the 16 plus category. This doesn't include the 12 to 15-year-olds yet, but 46% of them have been fully vaccinated, which also is good news. But we need to do better. We need to do a lot better. And we need to do better as quickly as we can. I want to talk a little bit today about why people should get vaccinated and should get vaccinated as soon as they possibly can. We really do appreciate all of those who rushed out, who waited in line, who refreshed their screens and checked online over and over for an appointment. That was a problem a couple of months ago because the demand was so high, the demand outpaced supply. And now we have a lot of supply and the demand has softened, partly because a lot of people have already gotten vaccinated. And another reason is because there are a lot of people who are either, a little bit hesitant or just, busy. And it's kind of a pain to go get the vaccine. But we want to make things as easy as possible for people. And we really want people to get out there and get vaccinated. So a lot of locations throughout the state have now moved to a walk-in basis where you don't even need an appointment. You can just walk in and get a vaccine. We encourage people to do this. Think about the things that you can do once you're safely vaccinated and not have to worry. As cases continue to drop, we expect that businesses, fewer and fewer businesses will be requiring masks. And we expect really to reduce the possibility of serious variants of the virus popping up and taking hold. And reproducing at large scale and making us kind of have to start over with the pandemic. That's what we're really worried about. We've come a long, long way, and we do not want to go backward. The vaccines have been shown to be effective against variants. And the more a virus replicates, the higher the probability of a mutation or a variant that the vaccine doesn't protect against. And as the virus spread slows, it doesn't replicate as much. And so we really need people to get vaccinated so that we can protect our population against serious variants. Again, let's use all of the things that we've learned in this past year to move forward and not go backward. A real quick update on vaccine equity. Uber and Lyft. We talked about Lyft a couple weeks ago, and now Uber and Lyft are both offering free rides to anyone who has a vaccination appointment. This is a really historic commitment, and Uber and Lyft will both promote rides to and from tens of thousands of vaccination sites through their apps. So people will be able to just simply select a vaccination site near them. They'll follow some simple directions to redeem their ride and then get a ride to take them to and from a nearby vaccination site free of charge. This feature will launch in the next 2 weeks and run through July 4th. So please take advantage of that if you are someone who needs a lift, a ride to your vaccination appointment. Now, I want to talk a little bit about Unified Command. This state response to COVID-19 is bigger than any single effort that we have ever undertaken in our state. And thousands of state employees and others have dropped everything during this past year to participate and to do everything that they can to monitor and to respond to this pandemic. Since March 26th of last year, we relied on an interagency effort to manage the state response to the pandemic. In a crisis, you call on your friends. So we called on our state agencies to come and support the Utah Department of Health, and we called our joint leadership efforts Unified Command. And it brought key leaders and staff together. It's allowed us to make sure that the Utah Department of Health has all of the resources they need. We've been able to collaborate and to communicate and to do this together. As we continue to see the declining case counts, and most importantly, our hospital intensive care units are in a really manageable place right now. It's time for us to officially start releasing our state employees to go back to their regular jobs. So starting on Monday, our pandemic response will revert to the sole command of the Utah Department of Health under the direction of Executive Director Rich Saunders. I really want to thank especially our Public Safety Commissioner, Jess Anderson, for his tireless service as the incident commander since March of last year. Thank you also to Dean Taylor Randall of the Eccles School of Business at the University of Utah for his valuable insight and partnership with our economic response. A number of state employees are going to continue supporting the Utah Department of Health for the foreseeable future, and we will continue these weekly media briefings through the end of May, and then likely after that we're going to slow down the pace of these briefings. This is all very good news. It just shows that we are in a good place, and we can see the light at the end of the tunnel, and we're all really excited about it. Coronavirus.utah.gov and its data dashboards will continue to function, as will the Utah Coronavirus social media accounts. Thank you.
Thank you for having me here today, and we'll start with a quick data update. Our rolling 7-day average for positive cases was 328 cases per day, which is down slightly from last week at 343 cases per day. Our rolling 7-day average percent positivity person over person is at 6.7%, which is solidly stable from the same numbers last week. Our rolling 7-day average percent positivity test over test is 3.6%, a titch up from 3.5% last week. And so overall, you can see we're continuing to be in a stable to slightly improving phase of the response as cases steadily decline. I'm a pediatrician, and the most exciting news of the week came today is the launch of the 12 to 15-year-old Pfizer vaccinations. We have this immense opportunity to vaccinate children and get them back to lives as normal. They've really suffered through the pandemic in terms of not being able to participate in their normal activities the way they're used to, and this is exciting news. Right now, throughout the state, vaccine providers are getting COVID-19 shots in arms of 12 to 15-year-olds today, right now. And we are doing this through many mechanisms. The first is we now have 117 practices that are receiving vaccine in their locations. We distribute the Moderna vaccine through the VOM system, where providers can actually request vaccines direct to them in the amount that they need. For Pfizer, which came with storage challenges and large vats of over 1,000 doses, those are being stored in the local health departments, and transfer requests can be made so that we can get Pfizer into the providers' offices. We're leveraging our mobile response, our mobile capacity, and inviting pediatricians and family practice providers to bring vaccine to them en masse through mass clinics using our mobile assets. We're marrying trusted voices of these providers with the assets that we have available to us to get vaccines out as quickly as possible. One of the things that we do need is we need parents. We need parents to reach to their doctors, to have those difficult conversations. We expect that there's going to be hesitancy as we move down in age, because children are more fragile. We will have more questions. We won't just take something that we took ourselves and necessarily expect that I want to do that to my child. We need them to communicate with their providers. We want those providers to communicate with their patients. And that is the shift in our response right now, where we're moving vaccine into those provider offices so that they can get their patients while they're with them. They're having those crucial conversations, and we're getting more Utahns vaccinated. Of course, the community vaccination sites will still be available, and you visit coronavirus.utah.gov to find out where you can get your child vaccinated now, today. So thank you.
Thank you, Dr. Hofmann. We now have a few minutes for questions from our friends in the media. And we have Lieutenant Governor and Dr. Hofmann are both here available. Hi, Lisa.
Hi. I'm just wondering if we can hear from Dr. Hofmann about ending the mask mandate for kids the last week of school, whether there's concern that there won't be compliance with the mandate starting now because of this decision, how that will affect enforcing the mandate that's in place until that last week,
Gotcha.
and what that means overall for the health of kids. Thanks.
Thanks, Lisa.
You know, this is a really, really challenging subject as a pediatrician and public health professional, but I'll tell you, I've watched the governor's deliberation process. He listened to all stakeholders. I had an opportunity to weigh in. As a pediatrician, I would encourage every parent to send their child to school in a mask. I also encourage every adult to still wear a mask. We have public health interventions. We have to trade one effective one, which is masks, for another very effective one, even more effective, honestly, than masks, which is vaccinations. And we want everyone to flip one for the other. Until we have more widespread vaccination, masks are still a very effective public health intervention, and students should, I'm encouraging them as a pediatrician to wear them. That said, this is a very challenging subject. The governor listened to input from all sides. I know he cares deeply about the health and safety of all Utahns. And we know that it doesn't take a mandate in order to get people to wear masks. We ended the statewide mask mandate over a month ago, and we still see people wearing masks. This is our time in the response to rely on our citizens to do the right thing, to protect themselves and to protect others. And that's where we're at today. So I encourage everyone to continue to wear their masks. We do rely on the schools to, and we have they've been working at this for a very long time. We have a very detailed school manual. They know the right things to do, and they've been doing them, and they will continue to do them and make those decisions locally at the school level. Thank you.
But again, if I could just follow up, are you worried that announcing that the mandate will be lifted the last week of school will result in a lot of people just giving up on it? As you say, some people are still wearing masks after the state mandate lifted, but many are not. And it's kind of like vaccines, right? If enough people do it, it's effective. If enough people don't do it, not so much. What's the concern there?
Again, so I'll just share a personal account. You know, this news came yesterday to me as a pediatrician and public health professional. And I sat down with my children at the dinner table. They're both in high school. One is 15 and one is 17. And I asked him, if your school decides not to wear masks, or the children at your school aren't wearing masks, what are we going to do? What do you want to do? My son said, I'm fully immune. I've been vaccinated. I'm going to wear my mask and I want to go to school. My daughter said, I haven't had a chance to be vaccinated yet. Her appointment's tomorrow. I don't feel comfortable going to school. I don't want to go to school. I'll stay home. We have to be able to have these conversations at an individual level, assess risks as parents of children, and do the right thing. Let's let our children witness that we can all do this together. Let's not use them as instruments either. Thank you.
Thank you so much. And this is Chris Reed, St. George News. And first of all, Dr. Hofmann, welcome to the firing line. Thank you for taking the time. This question may also go for Lieutenant Governor as well, but how much of an influence was Washington County choosing to end its mask mandate unilaterally last week involved in the decision? I know the governor mentioned that this is something that's been considered for a month, but how much did Washington County School District's decision, if anything, accelerate this decision?
Thank you for the question. I don't know that there was any school district specifically that accelerated this. This is something, as the governor said, he said a month or 6 weeks. It might have been longer than that we've been discussing this. We recognize that some parents are not happy with the mask mandates. Our overall goal the entire school year was to keep kids in school. That was really, to keep kids in school, of course, and to protect the public, to protect the people at home that they might, or out in the community that they might be spreading the virus to if they were to contract it at school. And as we have been able to get the resources that we didn't have last year that we do have now, the vaccines, KN95 masks. We have resources now for people to be able to protect themselves if they so choose. And that's the difference right now. We didn't have that before. And so we needed everybody to take it upon themselves personally to protect others. And we still want them to do that. We still want you to think of others. But now we have the resources, and it's been, we've had almost everybody has had a chance that has previously been eligible to get a vaccine if they want one. And so that burden really needs to be shifted now onto the shoulders of the individual. So I don't know that there was any one school district or any one action that tipped us over the edge to make this decision, to have the governor make this decision. It is something that has been in the back of his mind and something that we have talked about for several months.
As a quick follow-up for Dr. Hofmann, we're in the southern portion of the state, and just across our border yesterday was the first sign of the variant that had its origins in India, which is certainly dealing with a serious problem. The Lieutenant Governor mentioned variants earlier. The state's doing pretty well, obviously, as far as new infections, but how concerned are we still about these variants? Is this a little more of a lack of a better term, ballyhooed issue, or is there a real threat for these variants that are starting to move in?
So we do know that the variants are a continued issue. But we do know that we have a safe way to protect against them through vaccination. For schools specifically, as has been the case throughout the pandemic, we know we can have super spreader events. We still need to practice safe infection prevention and control practices to mitigate threats related to variants. We've had instances of events where we've seen spread of variant cases. I had an opportunity before coming into this role to participate in our nursing home response. We still have frail, vulnerable, elderly people in nursing homes that remain unprotected. Tomorrow, the federal government announced that we're going to need to be vaccinating up to 75% of staff who work in nursing homes because we didn't have a high enough uptake. And there's still a threat there, and we're seeing some variant cases there. So this is a very iterative process. We need ongoing surveillance. We have a very robust system to detect variants and to detect spread of variants, and we're going to continue to do that. So thank you.
Thanks. We have time for just 2 more questions. That's it. All right. Well, in that case, we will conclude for this week. If I'm not mistaken, next week is the governor's. Are we on PBS next week? Yes. Next week is the monthly news conference with PBS Utah. So slightly different format next week. But thank you everyone for your attendance, for getting the story out. And we always appreciate the work of our interpreters. And thank you, Dr. Hofmann. Have a good afternoon.